I'm Dr. Rosen. I'm the Director of Radiation Oncology at the Willis Knighton Cancer Center in Shreveport, Louisiana in the United States. Historically, proton therapy was only in the largest of academic centers. I think in Shreveport we were the model to show as the first ProteusONE site that a community hospital with the right resources and good physics support and good hospital support can certainly institute a proton therapy program. Proton therapy is very doable if you have the resources and time and the willingness to provide that therapy. For the right patient, it can really result in an improved outcome, less side effects, more tolerability, and perhaps even faster treatment courses. There's this well-known concept called the halo effect, where you see an increase in referrals. We saw that very early on when we put in our ProteusONE. We had referrals from competing institutions. We had referrals from centers and that would normally not have referred to our department. But we also saw a huge increase in self-referrals because the patient knows about this technology. Proton therapy is a clear advantage in many body sites and for many cancers. And patients want access to it. So I think even larger institutions that don't yet have proton therapy need to begin to kind of join the party. One of the reasons why ProteusONE allows us to treat so many different indications is the entire platform. It's compact, it has a robotic couch. The fact that it's not a full ring gantry allows us to treat some complicated brain tumors with a vertex field. We find that really the way and the speed of which you can do the treatment and the dosimetry that results from the small spot size really allows most cases that would be candidates for traditional IMRT. Selected patients, of course, are also candidates for proton therapy. We had looked at numerous vendors and in fact even were with a previous vendor before we made a switch to IBA. I think what we were looking for was a partner that brought expertise in the technology, the research, the support, the ability to help us develop the system. And IBA, being the world leader in proton therapy, which they remain, has really given us everything we had hoped for and more. Having IBA professionals in our cancer center, it's just remarkable. The folks that are based at our facility have become like family. They're part of our department. They are so important to make sure that if there's issues with a patient's treatment, issues with machine or technology, they're usually right on top of it. And as a result, we've been able to maintain one of the highest uptimes of any machine in the country around the world. Proton therapy on ProteusONE to a patient feels very similar to getting treatment in a regular linear accelerator vault. The machine is small, the room is comforting. Of course, we were the first site to have the ambient experience, and so our patients feel very comfortable with the coloring, the lighting, the music, the videos. But I think also just the entire knowledge that a patient is receiving the most advanced therapy in the world really benefits our patients. So they feel better about their treatment. Becoming a proton therapy facility really changed the entire nature of our cancer center and really our state. We think that proton therapy elevated the quality of care in our department, and IBA was a perfect partner for that. They have been side by side with us from day one, and the ProteusONE was really developed for centers like ours.